what we need to do to minimize this and, help people from this embarrassment is we need to exfoliate, and then we need to deeply hydrate. Just yesterday, I was answering a question, and this is a super, super common question. I know you've had to answer it 100 million times yourself. This person had keratosis pilaris, and they wanted to know what they could do. So keratosis pilaris, that is when, most people get it in the back of their arms. I think that's probably the most common, but you can get it on like your legs and your trunk and even your face in some areas. But what this is it's like a buildup of keratin in your skin, and it's kind of hard and bumpy. They call it, bumpy and rough skin. There's a lot of things out for that now. But what we need to do to minimize this and, help people from this embarrassment is we need to exfoliate, and then we need to deeply hydrate. So what I usually like to tell people is, there are a lot of things that you can do, but if I had to pick a single product, I would pick our Treat Body Lotion.
Absolutely.
And this has 25% acid, so this is going to give you the exfoliation. And it also is very moisturizing. There's a lot of different moisturizers in this. So if somebody had to pick just one thing to use every single day, I grab for Treat. Now, what do you say when people call you or email?
I recommend 2 products normally, and it would be the body wash. And I recommend using it in the shower daily with the loofah. I say less is more. 1 pump goes a long way on the loofah. I recommend the Treat. I say less is more. 1 pump. I tell them start maybe every other day, depending. Sometimes the area is a little sensitive.
Well, and it says that on here too. So I mean, let's clarify. Like, this is a treatment. This isn't a normal everyday body lotion. Most of the time, you're only going to apply this, somewhere between 2 and 5 times per week.
And I always say wash your hands after, because it is an acid-based treatment lotion.
It has a little bit of a stick. Tasted it.
It's got a little bit of sticky feeling to it, so it's always good to cleanse your skin afterward.
I agree.
After you apply it. So those are the 2 I normally recommend, and usually they get fantastic results.
I think that's good. And the only thing that I would add is sometimes, let's say this is not quite moisturizing enough. Well, then you can add on another moisturizer. I mean, I would say always put this on or, exfoliate with the body wash. But if you need more moisture, either the emo oil or the shea butter. I think this emo oil is great because it's, anti-inflammatory. It's so soothing and healing. And if you are irritated, this will really soothe. So I do like this one. If you need a longer, more hydrating, this is a butter. This is going to give you that moist feeling all day long. They could put this on too.
Excellent.
Now, some people, maybe they use this, maybe they have extremely aggressive, lots of formation and all over their body. If they want to do a peel like once a month or once every couple months, I would suggest something like, you could do a milder peel, like maybe a lactic 50 or something. If that's not providing enough results, I would say, TCA over some of the other acids. I think TCA penetrates a little deeper, so to get more of that skin off, that keratinous plugs out. So I think this would be a good option. And then again, afterwards, emo oil, shea butter.
For sure.
And, it's going to take like a month for your skin to peel. So the only thing I would want to mention, a caveat, if you're using a peel, is you're not going to necessarily be able to use Treat immediately after a peel. It's going to be too irritating.
Too, you'd want to stop that maybe a week before.
We always say at least 4 to 6 days prior. I do find, though, if you do a body peel, you have like that 30 days to turn over. It usually starts getting dry, like 10 to 14 days after. And then, you're going to be another 10 to 14 days or more flaking. Once you're past that, once you've started physically flaking, I feel like it it's okay to put this on.
Right.
But if for any reason it burns or is really uncomfortable, take it off and wait another week.
For sure.
And then you can start using it again. But that's why it might be nice to do a peel like once every couple weeks.
Right.
But that's a super common one. I can't even tell you how many times I've answered that question. Even in the group and in emails, it's constant for years.
Exactly. My first instinct is to start with the dailies. If you are not seeing enough with these two products here, then I would maybe go for the peel. But most times they're pretty happy with what they're seeing from the body wash and the triple treat.
I agree. Yeah, it's very strong.
Yeah.
And we used to, gosh, so many years ago, we had that in a milder percentage.
Yeah.
And I remember KP, Keratosis Pilaris, was one of the main factors that I was thinking about when we were making this a stronger acid so we could get more exfoliation. So yeah, it's doing its job, and it was a little bit meant for that. But
Fun backstory about the triple treat was when we were formulating the triple treat, when we were in, calls with the chemist, and, you were really pushing to have the acid content raised. And
yeah, they're fighting me on it.
They were saying, the formula can only stably hold this. And then you were like, well, let's see, go back to the drawing board and see what you can do to find some ingredients to stably hold more acid. And guess what?
Yeah, there it is.
Ta-da! They did it. Yeah.
It did take a lot of time, though. I'll be honest. We've had some batches that maybe weren't perfect, but now it's perfect.
Exactly. And that's why we always try to put the most action-packed ingredients that the formulas can stably hold for the most affordable product that is effective.
Absolutely. So, I mean, this is straightforward, easy to apply. I mean, we already discussed that, but, if you have more questions, just reach out to us.
Yes, 100%.
Support at PlatinumSkincare.com. Call us, join the group, Facebook, Platinum Skincare Gurus.
Regimen Builder.
Peel University. There's so many things.
So many. We're here to help you.
That's it.